So when we're talking about aesthetic implants and matching to adjacent teeth, what we're asking is that we make it look as natural as possible, that it's not actually a tooth. It doesn't look like a tooth. And one of the best ways to do that is having a custom shade design by the lab. And so we work with the lab locally that allows our patients to go there and the lab will actually match the tooth. Not only that, we take lots of photos and we also try to match the gum line if possible, because a lot of people don't think about the gingival aesthetics or the pink aesthetics is what we call it. So whenever we're looking at implants and we're looking at the size of the implant and the placement of the implant, we have a CBCT scan that allows us to place the implant exactly where we need to place it. And from that, we have a series of measurements we take prior to the surgery in order to ensure that we have enough height, space, width, and depth of the implant and the implant placement of the crown so that it fits perfectly in the patient's mouth. So to ensure that the investment lasts of an implant, the best thing to do is just like your regular teeth is come to the dental office and make sure you come to your dental cleanings, treat it like a regular tooth. However, what you want to do is you want to be able to not forget that that tooth is in your mouth. A lot of patients their dental disease will actually get worse when they start skipping out on their dental appointments. So if we spot something early, like early implant failure, we can do something about it, and oftentimes we can stop it or reverse it. But imagine that work or that problem continues and continues that you skip out on your dental appointments, then it becomes a lot more difficult to manage. So, what sets our practice apart when it comes to aesthetic outcomes and dental implants is we use the methods that work from some of the best surgeons in the country. And so, what we do is we try to place immediate implants with placing the temporary immediately. That gives you the best gingival contour. Sometimes dental offices, they may not do that just because of the complexity behind placing an immediate temporary. However, studies have shown that it gives you the best aesthetics, and that's something that we do that's different. So, some common misconceptions patients have when getting a dental implant is that they're going to match exactly like the adjacent teeth. Now, a lot of times we can do that. However, the bone and the gingiva is all dependent on the patient. So, that's the patient's phenotype, is what we call it. And so, what they're currently having, what they present with. So, if a patient has a certain amount of bone, we could only place the implant in that bone. We can try to grow that bone back, but it's not always guaranteed. We can try to grow some of that gum tissue back, but it's not always guaranteed. And I think managing expectations during that is the probably the most important part of when it comes to aesthetic implants. It's looking at what we have and what we can reasonably achieve. So when it comes to the recovery process, when an aesthetic implant is placed, what we do is we place the implant, and after the patient is numb, we really try to avoid them hitting on anything, biting on anything, or chewing on anything. We don't want any of those micro movements because that can always fail the implant. We, especially within the first month, is the most important time for healing, is when the implant becomes tighter and tighter over time. It takes a total about 3 to 6 months for the implant to fully integrate, meaning where we can put a tooth on top of it afterwards. And then we're talking about integration, we're talking about the implant integration into the bone. So an aesthetic implant, the way it establishes overall confidence, but not only smile, is basically you don't have to ever look at yourself with a, being toothless. I had a patient where she had a flipper and she continuously would have to, when she brushed her teeth, she had the flipper out and she had to look at herself in the mirror. Her daughter would say something to her. Now we placed an aesthetic implant. Seamless, doesn't even look like her flipper anymore, looks like her real tooth. And now she's smiling all the time. She thanks me all the time. And as a result of that, I mean, you can see her confidence boost up just because she doesn't have to take that tooth out of her mouth ever. She comes to her dental appointment, she's a lot happier, doesn't have to deal with that flipper, having a lot of plaque and stuff hanging on there. And a lot of patients rather have something that stays in the mouth rather than removable.